Healthcare is changing, and Dr. Nancy RN is here for you. The topics are many, but each program stands on its own with 3 key action points for you to learn. Your guide to a healthier you in a changing world. Dr. Nancy RN.
Welcome to Dr. Nancy RN. Healthy world, healthy nation, healthy you. I'm Nancy Valentine, PhD and registered nurse, and this show is dedicated to you, the healthcare consumer. And our show today is going to focus on school nursing. This is a show that's part of a series on school nursing. You may think, school nursing? I don't even know that much about it, but that's part of why we're having this series, so that you as a consumer will become much more knowledgeable about the many talents and skills that school nurses possess and how they contribute mightily to the community, not just to each child and each family, but to you as the community at large. And this is really very, very important for us to really appreciate. And so this series will help to inform you, and hopefully you will have skills that you can then utilize as you go and have interactions with various school nurses that you may meet in your life. Our first guest today that we're having is Martha Dewey Berggren. And Martha and I actually worked together at the University of Illinois at Chicago College of Nursing. And Martha is a national expert in school nursing. And she spends her time at the University of Illinois at Chicago teaching other nurses about population health and school nursing related activities to nurses that are also getting their doctoral degrees, just as Martha has hers. And she is currently the director of the Advanced Population Health Systems Leadership course there. She is also working at the Johnson & Johnson School Health Leadership Program, and we're going to talk about this in the program today because this is a really very interesting program that is supported by the Johnson & Johnson Foundation because they have a great interest in school nurses and what they contribute. So we're going to start with this discussion about Martha and why she became a school nurse as a life choice. So the title of our program today is The Unique Challenges of Being a School Nurse Professional, because it's a profession that is a choice that brings lifelong lasting dividends. So welcome, Martha. Thank you so much for coming from Chicago to be with us today.
I appreciate it.
And first of all, tell us why you're here in Philadelphia.
We've been here all week long at the National Association of School Nurses Conference. It was held in Center City, Philadelphia, where we heard school nurse experts from all over the country sharing their success stories and their knowledge for all to participate in.
That's wonderful.
It was fabulous.
So just tell us, how many school nurses showed up for this conference?
We had over 1,500 school nurses come to the annual conference, and multiple sessions, speakers. Susan Hassmiller from Robert Wood Johnson Foundation was one of the main speakers. Dr. Paul Offit from Children's Hospital of Philadelphia talked to us about immunizations. It was a great week.
That is great. Well, thanks so much for being with us. And Martha was really also the architect of bringing some of her other colleagues with her, and we are going to be making this, as I said earlier, a series on school nursing because we brought together all the school nurses for their conference in Philadelphia, so we decided to take advantage of such a talent pool and really bring some of this information to you as the listeners. So Martha, when you started at Penn State, you graduated from Penn State, then you went to Children's Hospital, you took a role there. Tell us about your career and how it sort of took off and evolved.
Well, I always knew that I wanted to go into school nursing when I was at Penn State. We did a lot of community health and population health activities, and there was an elective in school nursing, which I took. And absolutely loved it. Worked with some fabulous nurses in the center of the State College, Pennsylvania. So after college, I started in the infant ICU at Children's Hospital of Philadelphia at CHOP, and worked there for several years before I started following my husband around the country with his position. And I worked as a school nurse in many different communities. I worked in rural Texas with early childhood special education. I worked at a boarding school out in California at the foot of Mount Diablo in Danville, California. And I've worked in middle schools again in early childhood education in Minnetonka, Minnesota.
Wow, so you did really get around.
Yes, I did. And that's one of the beauties of nursing, is being able to transfer my skills no matter where our travels took us.
Right, right. That's a real plug for anybody that's listening that wants to become a nurse. It is really a very robust profession and gives you a lot of choices.
Lots of choices, lots of variety. It's been a great career.
Right. But let's get back to that school nursing elective. Isn't that unusual for a school of nursing to have an elective in school nursing? I frankly haven't heard of that before.
I actually am not sure. I think it is kind of unique to have an elective for undergraduate students, but back, we had a number of different electives we could take. Emergency room nursing, I took that too. I did a 10-week experience in a neonatal ICU. So just putting in a plug for Penn State, it offered a fabulous foundation for all the career interests I might have, and I just really took to that school nursing class.
I think that's really quite interesting, because most people that I have ever met, and I have to admit I haven't met that many school nurses, they sort of like get into school nursing by default. It's not really a clear career choice like it was in your case. And can you say something about that?
I have had others say that, well, I just saw an opening and I applied for it because I was looking for a job, and once I was in it, I absolutely loved it. But for me, it really was I always knew I wanted to work with children, and working in the school, in the community, just felt so natural to me, and being able to keep kids healthy. I also really liked running my own day and running my own little small business within the walls of the school, where I set priorities and picked out which initiatives I wanted to work on, whereas in the hospital, you're really working to get the children that you're assigned to healthy through the day, whereas I could identify which population initiatives I wanted to work on within my schools on my own timetable and towards the missions of the school and the community. And I enjoyed that. I've had fabulous supervisors and assistant superintendents. I've worked with great people who really appreciated having an expert in the building who could look at the health of the students and advise them on what was best.
I think that's really a very interesting discussion, because the uniqueness of having that independence versus being part of a much larger team in a more traditional healthcare environment sounds like it gave you a chance to be very creative.
Oh, absolutely. You could, if you had particular interests where you saw a need within the school or within the community, you would bring together your partners and advance that. Throwing health fairs. I identified a problem in the boarding school with students staying out of class, so sleeping in instead of going to their first period class, and approach the administration saying, let's look at this, what's really happening here, and found that they were staying up too late, eating pizza at 2 a.m. and missing, valuable lessons. They really needed to be in the classroom at 8 o'clock in the morning, and we put together a program to rectify that. I also worked with the mental health counselors there for children who had individual health needs that needed a multidisciplinary approach, and worked with the teachers if they thought a child was needing special attention.
Right. Well, let's talk a little bit about that in detail, because I think most people think of the school nurse as like a very nice person that you go to if you really want to like get out of class, or maybe they have an aspirin and Band-Aids, and so people in general, and also other nurses, do not really see this in its full context, which is the beauty of really having this conversation with you. So I think in terms of what you've shared so far, even parents would like to know, what was the secret sauce of your intervention with the kids at the boarding school that the parents are paying for, of course, to get a good education, that are sleeping through the classes?
Right.
Okay, so how did you deal with that?
It was a policy intervention. We instituted a policy. I had been doing the rounds, walking through the dorms each morning and seeing a list on the wall of who was not feeling well, and then I would visit them. And I suggested that students who didn't need to stay in bed, they weren't so sick that they needed to stay in bed, they had to come see me in my office before I started my rounds. Well, that kind of defeats the purpose. Once they're up and out of bed,
Right.
they're well enough to go to class, and very few students stopped in my office to see me once that policy was changed. And I would then do the rounds. I had been seeing probably 10, 12 students a morning, and by the time I reached the final dorm, they had already missed 2.5 classes. You know, it would take me that long to get through all the dorms. But when we changed the intervention, I was only seeing 1 or 2 students a morning who were truly ill and needed treatment or to see a physician. And it was a great solution because it kept the kids in class where they belonged. Plus, it's teaching them a lifelong skill of being responsible and getting yourself up in the morning and planning for that the night before.
Right. So let me just see if I've got this straight. You went from going out and seeing all the students in the various dorms, which took a lot of time, to they having to come see you.
If they were walking and talking, yeah.
Right. If they were so sick that they couldn't do that, then
They could
it was
wait.
probably legitimate, and then you did see them. So this is what parents could do. I mean,
Absolutely.
so you really instituted a rule-based solution, that you had
Yeah.
like a new rule, but it was a good rule.
Yeah, policy-based, rule-based, yeah. Yeah, as systems change.
Right. And that's a good way of putting it. And how did the students respond to it?
You know, they knew they were getting away with something. They were very positive. They enjoyed the school. They enjoyed our relationship, and they knew they had been caught. And
Yeah. Right.
yeah.
So I think that's a good example. How about another example of something that you saw in one of your respective jobs, and you worked with, you said another group, you worked with a team to have a solution. What would that entail?
Well, I would say that it was probably the time that I had a student who the team of non-nurses thought that the mother was not feeding the child correctly, and this would have been in my early childhood role within a school setting. And I don't think most people know that 51% of school nurses do home visits, and in this circumstance I always would make a home visit to the family and observe the mother feeding the child, looking at the types of food that she was feeding them, and it's done as a friendly visit. You know, I just went out to do the typical physical assessment and a health history, and observed that the mother certainly was feeding the child and loving towards the child. It was a natural home environment, and I shared that I really thought there was a physiological reason for the child's lack of growth. The child was not growing at the pace that a typical child grows.
Now, can I just stop you with
Sure.
that? Did that family get that feedback from the pediatrician? Did they have any other input to that problem other than your visit?
Yes, we always work closely with the primary care provider, the physician or the nurse practitioner, and any concerns that they may have. So that is one of the roles that a lot of people don't know the school nurse has, and that's of a case coordinator for children with conditions that are complex. You know, this was a situation where we really didn't know what the situation was, and I was going out to the home to assess it. But for instance, another child I took care of who came to school every day on a ventilator, I was the only person who spoke to all 8 of his physicians and his parents and the team members at the school setting. So frequently we would find out mistakes in communication. One physician didn't know what medications the child might be on. Another didn't even realize he had a neurologic, or say a kidney problem or something, because you're the only one who's interfacing with all the professionals.
So with the child that was really not growing and had a thriving problem, what was the intervention there?
Well, it actually turned out to be a congenital issue with a area of the brain that had not developed fully. So she had what one might consider a mild form of cerebral palsy, which also came along with a growth, slow growth. And the intervention was to enroll her in an early childhood intervention program where she and the parents received instruction on how to escalate her development through different activities, reading, fine motor, gross motor, in addition to making sure her diet was maintained, so she didn't lose any more weight or started to grow a little faster. But she was never going to be a large child. she was always going to have some growth retardation.
Right.
So it turned a situation from where they thought the mother was being neglectful to one where we were supporting the mother, supporting her own child.
Right. So that was really what I was getting at. I think that there was obviously a pediatrician involved, but nothing takes the place of a home visit by
Absolutely.
a skilled nursing professional, someone who knows what they're looking at, knows how to comfortably dialogue with the mother.
Absolutely.
And get to a solution.
So I can tell another situation where a home visit was eye-opening. I was taking care of another child who we were very concerned about. Slow growth, not meeting the developmental milestones, was a couple months old, another early childhood situation I was working in, and made an arrangement. Very busy family. This was the child was one of twins. The mother had 2 other children, all under 5. I mean, crazy, difficult environment for her. She had her hands full.
Right.
So I made a home visit after work one day while she was trying to feed them dinner, and saw this child's twin for the first time. And he was significantly larger than the twin that we were seeing for intervention. And I asked a couple of questions, and I mentioned earlier that I worked in the neonatal ICU at Children's Hospital, so I am a neonatal nurse also, and started looking at some of the signs that show gestational age, the creases in the hands, the firmness of the ear, the size of the fontanelle, the soft spot on the top of the head. And I can't say I knew immediately, but I did not think these 2 children were the same gestational age. The child that we were seeing seemed tremendously younger than the other child, and I called the physician and said, what can you tell me about these 2 children? Thinking he would tell me he thought the same thing too. And he said, they were born in a very rural hospital, a frontier hospital actually, and I've only been taking care of them a couple of weeks. And so I kept talking to him about what I had seen, and I finally said, I don't think they're the same age. I think the one twin is a lot younger than the other. Long story short, they did some tests, brought them in for further examination and analysis, and it turned out that the twin that we were seeing was 2 months younger than the other twin. So the mother became pregnant while already pregnant with the first twin.
Oh my goodness.
Yes.
That's
So
very rare.
It is.
So she was carrying 2 babies in her womb at the same time, but they were conceived 2 months apart.
Yeah.
I don't know what the statistics are on that, but it's got to be pretty rare.
But when you talk about how did that change our approach to that family, the team, the physician, thought that there was a neglect situation going on with the twin that we were taking care of. And the team, the interventions that you do for neglect are different than the interventions you do if a child is very premature. And so therefore everything changed.
Right.
I mean, our entire approach to supporting the family, what types of interventions we were performing with the child, and we actually started performing whole family interventions to support the mom with these 4 young children.
Right. That must have been a tremendous support for her. She was already overwhelmed. How did she respond to all that?
It's tough when you have kids that have special needs, and she really did appreciate our support and the difference you can make with families that you're working with that closely and making the home visits and spending the time with them. I really feel that it's the most rewarding part of nursing, and seeing how much of a difference you can make in the life of a child and the life of a family. It can be night and day.
Right. But I think bringing it back to that school nurse base, where you in that case were out in the community, but you were also back at the ranch, so to speak.
Absolutely.
At the school, seeing the whole population of children.
Right.
I think really, again, is very skill building. You're able to make a lot of observations. You're able to intervene in different ways with different folks. But then your career went on, and you went from intervention on a one-on-one kind of basis, such as these dramatic stories, and then you really became more of a national figure in your field. How did you make that transition? What were some of the milestones there?
Well, I actually, to be honest, I had a college roommate whose husband died, and I had been going through grad school and doctoral program very slowly, and it kind of alerted me that I needed to speed things up, you know, that you never know what life is going to bring to your table, and finished my doctoral program, specialized in school health within that program, and taught at the university level, both at the University of Minnesota and the University of Illinois Chicago, and participated in summer leadership program, a program in Minnesota and then again in Illinois. That took me to a fabulous role at the National Association of School Nurses. I worked for 4 years there as the director of research and brought what I had learned as a part of those leadership programs to NASN. When I left NASN, I was looking for something and I actually got a phone call a few days later. I had participated while I was at NASN in a kind of a think tank on how to change the Johnson & Johnson School Health Leadership Program that had been going on for about 25 years, sponsored by a foundation within the Johnson & Johnson corporate fund, and was invited to participate in doing a complete revision of that program to make it more sustainable, enduring change for nurses, school nurses who work in the community. So for 25 years they had been investing in professional development for school nurses, but now they wanted to take advantage of what we know now about change agents and change leadership, and using a more community-based approach to building coalitions, conducting needs assessments, implementing evidence-based interventions, population interventions, and then evaluation. And this is an 18-month process.
Well, let's talk about that. First of all, I want to just set this up because I think this will be one of the most interesting parts of this discussion. Everyone knows that Johnson & Johnson has a worldwide mission to really have a positive influence, both products, services, but the foundation, as you will hear, has really spent a lot of money, time, and consideration on helping babies, children, and mothers. That is what Johnson & Johnson is so well known for. That is their mission, that is their brand, and we applaud them for everything that they have done in that area. But what Martha can tell us about is really her hands-on work with this program, which is really helping to give shape to some of the direction for school nurses. They've had a 30-year commitment to this, and as she is telling us, they made an even further commitment to strengthen the program and to revise it and to make it as current with national trends as possible. So your background in DC, Washington, DC, in this policy role that she was mentioning at the National Association for School Nurses was definitely a wonderful background and a stepping stone to her influence with the Johnson & Johnson School Health Program. So why don't you tell us, you used a lot of big words. People will not know what those big words mean.
Okay.
So bring it down to size and tell us about what this program actually does.
Sure. So I'm part of a interdisciplinary team of professionals.
Can you tell us what the interdisciplinary team would be comprised of?
Sure. The executive director, Laura Rothschild, is an adult education specialist and a school psychologist background, and she designs the creative teaching learning situations that we use at the Institute, which is a week-long program each summer in New Brunswick at the Johnson & Johnson headquarters.
Okay.
We have a organizational development individual, John Krieger, who helps us analyze the the systems that we work in and how to work positively within the systems that we're in and bring about change. We have an evaluation specialist, Tom Griffin, and then we also now brought in a writing specialist. We identified that school nurses were struggling with putting together bios and their abstracts for conferences and being able to craft advocacy messages and op-eds. And we now bring in a writing specialist from Princeton, Keith Shaw, to teach us how to write succinctly and concisely.
I think that's really fantastic, because this is an issue for all health professions. This is not just a nursing issue. And that is, you get a lot of smart people together, and they're really great at talking to one another. But to translate it for listeners such as yourselves, regular people, people that need these messages, that is a different skill.
It is, and I've learned so much from the team members. And then I'm the school nurse on the team who can connect those messages in a way that school nurses understand and how to apply it to the educational setting that we work in. So we recruit teams, usually 2 to 5 school nurses and 1 community partner. Could be a school superintendent, it could be a health department leader, and they come to us for an entire week in the summer. We help them with their needs assessment, looking at what are the biggest issues in their community. What does the community identify as the issue? Not you. What's not your issue? What is the community's issue that they want to address? And then help them put together a program to address that over 18 months. And I actually go visit them in their communities twice during that 18 months.
So it's a very practical, hands-on kind of program. If people were interested in learning more about this, or even potentially school nurses or other school administrators who would like to know more about this, how could they find out?
There's a website. It's the Rutgers Johnson & Johnson School Health Leadership Program. I'm sure we could provide the web address for that.
Yes, well, that'll be on the website where we will have Martha's show. So you can tune in to www.drnancyrn.com, and we'll have that on there along with your bio.
Great, great. And we open up applications in August through November each year for the following summer.
Okay, so give us an example of a project that you worked on.
Great. Right now, my team from Elko, Nevada, came here for the National Association of School Nurse Conference, and they presented a poster session on their project that they're working on. And within that town of Elko, Nevada, which is a gold mining community, they do not have public health support in that community. There is no public health professional in this town. And the school nurses themselves have been making sure that all of the children have the vaccines that they need in order to attend school each year. They want to make sure that those families that are new to the community, because mining is a very transitional community, any community with mining, young families come and go and show up, and hopefully we want them to start school the very next day. But because they were usually coming in from another state, they didn't have the immunizations required by Nevada. So they are now working with the state agency, Immunize Nevada, and the state public health department in order to bring resources to the community through the local hospital to bring all health professionals and all community professionals to the table to support the school's effort to keep kids healthy, keep them immunized, and have them stay in school and start school on that very first day that they're in the community.
Well, that's a wonderful example, and I want to thank Johnson & Johnson for supporting such an effort, because you can see by leveraging the talent of a team with Martha and others that it can really make a powerful difference in a community. Something that you can't necessarily just go in with a consultant and fix, or you can't hire more staff to fix. What they're doing is they're really helping to support the infrastructure of that town, to really bring the best out of the people that are there, already engaged in the work, already engaged in the program. And by Martha now she's moved from home visits to visiting towns and helping and whole communities. So her visiting has widened in its scope. I hope that you feel more enlightened about the wonderful contributions of a school nurse by listening to Martha's story. I have to tell you that when I met Martha just a year ago, I really did not know, as a nursing professional myself, about the depth and breadth and scope of school nursing. But Martha and others that I now work with at the University of Illinois, Chicago, have really enlightened me, and it's a really dynamic field, and I've come to really appreciate it. So I want to thank you again for being with us, and I want to thank you as our listeners for being with us as well. I hope you enjoyed this program and that you can watch it again on the website, and please share it with others. And I think if you know a school nurse, now you're going to really know that person even better, and thank that person for the wonderful job that they're doing. Have a wonderful day. I hope you enjoyed our conversation today and that the information will help you in meeting your health goals. Catch this program and other conversations on the website, drnancyrn.com. Or you can write to me as well. I welcome your comments and feedback. Thank you for listening, and join us again. And remember, with health, all things are possible.